our TLC theme. I'm just going to give some few, words, opening remarks by myself. We have a special interlude by one of our colleagues. So Dr. Carol Omar would be giving us a poem on our theme, so that yes, we can. We want to launch our recipe book. We don't think it's ready, but we want to give people, a taster of how this is going to look like. Then we have a few awards to a few people. We are going to launch our champions. We had a training. We had a training about 3 weeks ago. So we're just going to introduce these champions to you. Then we have a few words from our lead dietitian. We have Dr. Fay Bruce here as well. She's just joined us. She's going to say some few words. Then we have an open forum. We want to hear from everyone. It's the last session. Just tell us your thoughts, your impressions, anything you want us to know, please do let us know. And then we bring our session to an end. Okay, so I'm going to start with my own opening remarks. Yes, so as I said, it's been 24 weeks of intensive tailored nutrition and lifestyle support, education, but also support. And I just want to use this opportunity to say a big thank you to everybody, all of you. We wouldn't have been here if it wasn't for your dedication, your engagement, your consistency over the last 24 weeks. We all set out to achieve different goals. Some people wanted to lose weight, others wanted to eat more fruits and vegetables, and we collected some data. And as you saw from last week's panel discussion, a lot of people have achieved these goals they set for themselves and have even achieved more. There were other things that they hadn't thought about, but through engaging in this challenge, have realized that they have achieved so much more. Okay, we looked not only at our diets, we looked at other lifestyle activities, we looked at sleep, how we could get better sleep. We looked at posture, we looked at dental health, and many more lifestyle activities that we usually do not pay attention to. We have built a network or a community or a family, with a common goal to be able to lead healthier lives so that we can prevent diseases and better manage the chronic diseases that we are living with. So on our last session today, the last session for the challenge, I just want to congratulate everyone here and our colleagues who couldn't come, the 100 people on the page. We are so proud of you. We are so proud of everybody. It's not been easy committing to 90 minutes every week. And as you see, every week we have about 25 to 30 people, and then we see the other engagement on the page. So we want to say congratulations to everybody. Well done. And we hope that this will not be the end of the lifestyle changes you have made. This is just the beginning. Okay, so we hope that you're going to help yourself, continue with the network we have built, and stay on track. And that is why we have trained some of these community champions to help take what we are doing forward, so it does not end here. Now, last point I want to make, when we started, we shared some statistics about how we have the highest prevalence of overweight and obesity and all these diet-related conditions. Now, if we want to change that narrative for ourselves, for African and Caribbean people, this is one of the ways. The best way is to actually prevent it. And I'm sure we all know this by now. So we are hoping that this challenge would be the beginning of a new dawn to come for our community. Okay, I would just end my opening remarks here. This was just a taster of what is coming. And then once again, say thank you so much for all that you have done, your engagement, your consistency. And I hope that you contribute, you keep engaging, let this not be the end of the community or the network we have built for ourselves. This is not the end. It is just the end of that 90 minutes, session, and then this 24 weeks challenge. Everything that has a beginning must have an end. But we are still going to be there. Healthy Hearts will continue. Every Tuesday, there's going to be a session. It's going to be in a different format, so I just needed to make that clear. The challenge ends, but our lifestyle continues. It is the beginning of us leading healthier lives. Okay, so thank you once again. Now, I would like to call on Dr. Carol Ojwang, one of our colleagues, to give us an interlude. That is a poem on our theme, Yes, We Can. So, Dr. Carol, if you are here, can we hear your poem, please? And she did send it to me for me to project it. So I'm going to project, because I realized that Yes, We Can theme was really powerful. And so we thought we should share a poem on this.
Okay, thank you, Hibbah. Hi, everybody. Well done on coming to week 24 of the challenge. It's been quite an interesting journey, and you should all feel proud of yourselves for getting to this stage. Yes, oops. Well, it's not a particularly long poem, so it's not going to take too much of your time, but hopefully you will feel that it captures some of what you have gone through, learned, and felt during these 24 weeks of the Sahara TLC challenge. I don't have it in my head, so I'm basically going to be reading from, because you can recite poetry either by reading or by free form. Yeah, so here goes. Yes, Hibbah? Okay. Oh, I can actually read from the screen, thank you. Day 1 looks impossible. Carb counting, portion sizing, plating. Jollof and chips and big cake no longer options. Sahara TLC challenge sounds like a desert, an uphill climb. Yes, we can. Next. Week 2, a few days counting. Should I share my photograph? Should I not? Healthy enough, or am I slacking? What will they think? What will they say? Wait and see and wait. Yes, we can. Next. Week 6, like fine wine, getting better. A photo here, a step count there. No need to fear, feel free to share. Hit the ground running, meet that 10K. Fall down, take a beat, then get back up. No judgment here, only camaraderie. Yes, we can. Yes, we can. Week 12, the end is in sight. Hope lurks on the horizon. One alone, an exercise in futility. We've been there, we've tried, but one by one we make a bundle. And when we are a bundle, there's nothing too hard to handle. Yes, we can. Yes, we can. Week 24, now we're like family. The weighing scale, no longer the enemy. Portion size control, part of our anatomy. Walking together, we're now an army, the TLC army. Change is in the air, can you feel it? The atmosphere has shifted, can't you see it? Ready to spread the challenge, ready to spread the change, be the change. Sahara TLC challenge, yes we can.
Yes we can.
Yes we can, yes we do.
We can. Oh yes we did. Thank you. Carol, you should have asked us to join you to recite.
Yeah, at the end, yes we can, yes we did.
Yes, I think we should all recite this together. Yes, I think at the end we should all recite this together, Carol.
Okay, yes,
so Thank you for that beautiful recitation. I only asked Carol a few days ago. I was just thinking, what can we do as an interlude? I was like, Carol, can you write this poem for us? And then, she put this together for us. So thank you so much, Carol, for that beautiful poem.
You're welcome, Hibbah. Thank you.
So next on our agenda is the launch of our recipe book. Is Chika ready? Is Chika here? So we asked people to send us recipes, and I don't know how many people have been able to send their recipes because we want to create our own recipe book. And so I don't think it's ready, but I thought Chika should just show us what it looks like so that, others could still be encouraged to send us some more recipes. Because at the beginning, people were sharing all these beautiful and, delicious recipes. And I don't think at that point we had decided to do this recipe book. And so along the line, when we thought about this, we asked people and we're still waiting for a few more. So Chika, are you able to share your screen? Let's see what you are doing with our recipes so that hopefully we can get a few more people contributing.
Okay, good evening, everyone. Please permit me to share my screen. I can't share my screen.
Elizabeth, please, can you make Chika co-host for me?
Chika, I think you're co-host now.
Yes, just came on.
Okay.
Okay, can we see my screen?
Yes, we can.
Yes.
Okay, so the book is still very much in the rough, still getting recipes, still trying to get more recipes. So far, I've had just 2 people come up with recipes. So this is the beginning of the book. We're supposed to have an editorial or some sort of introduction that will keep on encouraging us each time we pick up this book to go through what we have in it. So the first thing I opened the book with is spice up your vegetables, because over time we have been encouraged to eat vegetables since it's one of the most important part of our meals. And we've had a lot of people not complain per se, but at least raise concerns about how they don't enjoy eating vegetables or how they can make their vegetables not be the same thing every time. We're tired of saying omelets and mixed vegetables every day. So we have tried to come up with some recipes on how you can spice up your vegetables and make your meals look very good. So we have lettuce wrap. The shopping list is there, all ingredients, and then the method. And like we said, we will obviously be crediting you once you bring in your recipe. So this particular one was given to us by Sylvia, and her name is right there. So the method for the cooking and then the things you'll need for the cooking is right there. You don't need to look far or second guess on what to do. Everything is right before you. And then we have chicken avocado salad. Some of the recipes I think you can make with leftovers from your previous meals. So if you go through your shopping list, you'll see that most of the meals have the same things in common. And then we have 1 pan roasted asparagus and baked salmon. We had a video tutorial on how to do this particular one. So this is just the method and how she went about it. So if we have the video, we can pair that with this and we see that it's really easy to follow. Again, Sylvia gave us this recipe. And then we have crispy Brussels sprout. I think this was the first one, the first cooking tutorial that we had. Shopping list, method. I've made it as simple, as easy, and as simple as possible, so we don't have any complexities while in the kitchen. This is supposed to be for an extra meal, but we're yet to figure out what to put there. And that's why I kept on saying, please send in your recipes. So we're going to have a really comprehensive booklet to hand out to everybody in due time. And then next, have a fruity day. So far for this particular section, we have gotten just one meal, and that's the parfait. Very easy. And then for some of the meals, we are going to be putting at the bottom, like what you see here, alternative ways to prepare them, especially when we get to the African meals parts, because some meals can be prepared with or without palm oil. So we'll be putting the main preparations and then alternative mains, or just things you can remove from your meals, somewhere at the bottom or the next pages. So we'll have parfait for the fruits, and that's the only one, like I said. So if you have any other ways with which you make eating fruits more interesting to you, we have one other recipes for this part, but I haven't been able to get it in, I'm sorry. The fruit salad is going to come in after this. And then welcome to Africa. It's an African and Caribbean program. I don't know any Caribbean meals. I don't know if they eat the same things we do in Africa. And that's why we kept on hammering, please send those recipes. So it's not just going to be a one-sided thing. So welcome to Africa. First, we have eforiru. I was working on this last night before I passed out. So I'm still working on the method. The list is already there. I'll also be putting pictures for every meal alongside the people who brought them in. And then these are the other meals that are supposed to come in. I haven't been able to put, but I listed them up so that I don't forget any of them, and I'll be able to remember those who brought them in. So pepper soup, okra, stir-fried beans pudding, giz dodo, pepper soup. And then the topping, this is extra meals that you can enjoy either during Christmas or anytime you want. Most of them are celebratory meals. So we have Christmas pudding, healthy one. We have coconut bulgur wheat, and then overnight oats get to come in also. For now, that's all we have. So it's, like I said, it's a diamond in the rough. So we are expecting more meals. We are expecting, if you have any notes that, any tips, cooking tips or anything that you think will be beneficial to all of us as a group, please send them in. If you don't want to send it to the group, you can send it to me personally. I can drop my email so you can forward anything you want to me, and then I'll work on it. The earlier we do this, the better, because now the program is coming to an end today. We were supposed to hand this in to you guys as a thank you package, but that's not possible. So we hope to get it out to every one of us within the week. So please, and please, if you have anything else to add, please contact either myself or Dr. Hibbah. Thank you.
Thank you so much, Chika, for that. Can you hear me?
Yes.
Yes. Thank you. I didn't see my own recipe that I sent to you.
I wrote it out somewhere. It's on my phone. I haven't gotten over to it. Yes, it's going to be at the topping part.
All right. Okay, that's fine. Thank you so much. Hopefully other people would send in some more recipes.
Yes, I hope so. Because if not, the recipe book is going to have just my name, Sylvia's name, and your name. And we are a lot here. So I need to see more names. I need to see more recipes.
Thank you so much. All right, so let's get on to the next activity. So on our agenda, we have the launch of our community champions. So Sylvia, can you project that for me? So 3 weeks ago, I think we put it on the page that we're going to do a training for people who want to be community ambassadors to take this forward. And we had about 13 people coming forward. So we had a 2-hour training for these volunteers. And we just want to introduce these people to you and also to CAHN. Yeah, so these are the community ambassadors. And we have Elva Douglas, we have Harriet Nyakwa, we have Nusrat Champong, we have Sandra Harris, we have Ramatu, we have Sarah, we have Victor, Chika, Sylvia, Fatia, and Toyiba. Now, what do I say? So to CAHN and to Fay, because I need to introduce Fay, who is the chair of CAHN. She's going to talk to us very soon. But this launch is to introduce these ambassadors to the rest of the community, because when we did the training, it was just us, myself, Dr. Alice, and these people. So we want to introduce them to the TLC community and also to CAHN, to let you know that these people have volunteered and put themselves out to be champions, community ambassadors. to be able to be role models, to be able to signpost people to resources. So all that we are doing, the nutrition education and the lifestyle education that we are doing, we are not always going to be there, but these people are going to be there to direct other people towards healthier lifestyle. So I don't know if they are all here. It would have been nice to just pin them or spotlight these people, these volunteers. I don't know if they have few words to say. I'm putting you on the spot. I didn't tell anybody this. I just said we're going to do a launch. If anybody here wants to say anything, please feel free to do so. Yeah, I see someone's hand is up. Okay, yes, please go ahead. Yeah, Toiba. Yes, yes, please.
Yeah, hello. Yeah, can you hear me?
Hello. Yes.
Yeah.
Yes.
Hi, everyone. Yeah, I just want to say thank you, Sahara, CAHN, for this nice program. It's rather unfortunate it's ending. We would have loved for it to continue. We've learned a lot. We all came in, crawling, and now we are walking up straight. All the myths that we heard about nutrition, everything has been corrected. And I just say it was very interesting. We've learned a lot. We all came in with different goals along the line. We picked up new goals, and if not all, but most of us have been able to achieve and even achieve more than we expected. So I just want to say thank you. And we've picked up the challenge, would introduce more people to it. And then, like you've said, as and when we need help, would always fall back on you. So that's just it. I don't want to come and then tell a long story, but I just want to say we are grateful. Thank you.
Thank you, Toiba. Thank you so much for volunteering to be an ambassador, a community champion as well. Thank you very much. Do we have anyone else who wants to say anything, especially our champions? I don't see a lot of our champions. I had a lot of apologies, like 4 or so. Sarah, our inspiration, is not here. She really wanted to speak. Who else? Any of our champions wants to say anything? Let's see who else is on.
You just sent me a message, man.
Who sent you a message?
Victor is at work right now.
Right. Okay.
So basically, just said he's very much happy for the challenge and how it has impacted his life. Okay. Not only as a nutritionist, but also being a community champion. So with this, we'll be able to help more in his community and even in his gym members as well. So he's very grateful, looking forward to the things people he can impact and the things he can do with all of he has learned.
Okay. All right. Okay. I don't see anyone's hand up, so we will move on to the next activity.
Can I just say something quickly, just to say thank you very much to Sahara for all that we've learned. And I'm one of the community champions and learned so much. And it's really been so informative. And we thank you for your time. Just echoing what was said earlier, that you've given up your time and we shared so much with us, and we've learned so much and we've grown so much. And we're just really grateful. Thank you very much. That's all I'm going to say.
Thank you, Sandra. Thank you so much. I think a lot of you actually just said a lot when we had the panel discussion as well. So thank you for speaking again today. Thank you, Sandra. Now, we have a few awards. Sylvia, can you please project those names for me? So after we had the first phase, if you'd remember, we recognized a lot of people, the people who were constantly, apologies for the noise in the background. My son won't stop talking. So, there are people who were consistently posting on the page. They did that breakfast, lunch, and dinner. We acknowledge these people and give them a small gift. The people who were always, going beyond the 10,000 steps challenge that we set for ourselves, so all of these people have already been recognized. But then we thought we should do more. So next slide, please. There were people who were happy to share the changes they were making. So Sarah, and you all know Sarah by now, so the most significant weight loss. We think that there might be other people who might have lost more. Sarah said 11 kilograms, but we haven't heard from other people. So Sarah said 11, someone said 9 kilograms, but so amongst those who shared their weight, we thought we should just acknowledge or give Sarah something for being the one with the most significant weight loss. So she sent a message to say that she has an emergency. There's a family member in the hospital, but we're going to provide her with a gift. We're going to post her something, just so that to inspire her that we appreciate her commitment and her dedication to this challenge. You saw her in the group. She's the one I describe as the police on the group, who is always, coming back at people to say you're not doing the right thing. And indeed, she's a living inspiration. She managed to get her weight down by 11 kilograms. Her diabetes blood sugar level has gone down. Her doctors have reduced her medication, and she's on her way to sending it to remission. I think that's how it's described. So Sarah, you're such an inspiration. We celebrate you, and we are happy that you participated in this challenge. Next person, please. Next award. So we invited people. This was open. It was meant for people in Manchester, but because it's virtual, people came from all over the country. But then we realized that there are people who brought on board their entire family. So there was a particular family in Manchester who were always on top when it came to the challenge. So the man was always getting beyond 10,000 steps. His daughter, the youngest participant, also in Manchester, called Azimat, was always getting 10,000 plus. And then the woman herself was. So in terms of physical activity, we thought we should recognize this family. So I don't know if they are on here. Yes, but it's a family, a man, a woman, and their daughter, all living in Manchester, who all on a daily basis went beyond the 10,000 steps all the time. So we thought we should recognize this family as well, because for lifestyle changes to be, sustainable, it is important that the whole family embraces it. So these are a model family, and we think that we should recognize them. So we are going to post something to this family, Dura Jaya family in Manchester. We applaud you, and we are really happy that you all came on board. And so you are a role model to all of us. The rest of us who couldn't bring all of our family members on board, hopefully we would learn from you and try to bring them on board as well. Yes. Our next award goes to the most motivated or engaged male participants. So, you realize that a lot of the participants were women. So Victor was one of the male participants who was always on the Tuesday sessions. He posted a few times, not all the time, but he was always engaging on the Tuesday sessions. And so we thought, Sylvia, can you please continue with this, please?
Yes, so we thought that we assume that Victor will be the best fit for this position. So for this award, the award goes to Victor. We have, because even also Victor is also one of our champions. He's one of our community champions, and he's been there right from the beginning. I don't think he joined from the first week though, but right from the week he joined, he's been very active. He's been communicating with people around him and things like that. So this one will go to Victor. The next
award. Can we see this award on behalf of Victor?
I don't think so. I don't think you can. It has to be Victor. It's a pity he's not online, because I know he would have been very excited to have this award. The next award will be the most inspiring participants.
So yes, we thought, Lorraine, you didn't start from the beginning, but ever since you joined, you've been inspiring every day. You put a message on the group, you're keeping us alive on the group, checking on us, and anytime we come for the Tuesday sessions, you're chatting and asking how people are doing. So we just wanted to, recognize you as well. I know Lorraine would say, give the gifts, give the award to someone, but at least let's mention your name. We need people like you in the community and in groups to keep the group going. So thank you so much, Lorraine. Thank you for being an inspiring participant and for keeping us going. Next participant, please. Lorraine is on. Yeah. And then we also wanted to recognize, our elderly participants. So there are about 3 women, and we have to look for these women. So this particular one, she wasn't posting, but behind the scenes, we were getting messages from some of these people. They were not posting, but they were putting what we were, all the activities into action, the teachings into action. So there are 2 or 3 women who stated that they were 70 plus. There's someone called Martha we have to look for. She's joined the sessions a number of times. And then there's Mariam. And then there's another person, I can't remember her name, but I'm sure they know themselves. So we're going to look for these 3 over 70-year-old participants who have actively engaged in this challenge. We want to applaud them. We want to recognize them for all that they did throughout the challenge. Do we have any more awards, Sylvia?
That's all.
That's all, right. Okay, so I just wanted to say that, like I said at the beginning, we appreciate everyone, everyone. A lot of people have done so, and you saw it on the group. People engaged really well, posting photos, doing their 10,000 challenges, and we won't be able to buy send everyone a gift, but then we want you to know that we recognize and appreciate everyone for all that you did. We just wanted to highlight a few people, but then we applaud everybody who participated in our challenge. Thank you so much. Right, so next on our agenda is Dr. Alice. Dr. Alice, please, it's your turn.
Okay, I think Ryan is happy today because he knows he can have full Tuesday. Yeah? So I'm just gonna share my slides. It's been a beautiful journey. I can't believe 24 weeks looked so much, so much, but here we are. So let's try this. And yeah, I didn't know I had a namesake in the team, Carol Ojwang, all this time. Interesting. So I'm just going to talk about, I hope I can be a motivational speaker this afternoon. So, oh, sorry, I always have 2 screens and this can be very confusing sometimes. So let's just detach. All right, so Stephen, tell me what you can see. Oh, did they stop sharing again?
I can see the screen with the nuts.
Nuts and bolts of staying in the game.
Yes, that one.
Yes, so it's 24 weeks later, we have come to the end of this week. And I really like the poem because when we were starting this journey, most people, okay, not most people, some people say that's impossible. When you gave them the cup portions and that you need to measure and eat like this, people were like, no, I can't even try it. But we have done it, okay? What does it take? It took you to try. It took you to actually believe in us, believe in Hibbah, believe in myself, and believe your colleagues who are talking to you. So it took your efforts to get here. And I know a lot of people have not said what they have lost, but there's somebody else who's lost more than 10 kilos, she told us in a meeting. And there are a lot of people who have achieved. So it's not just about weight loss. Is what else have you achieved? Some people have reported they sleep better. Some people have reported they've reduced the amount of money they spent on fuel or they spent on food. A lot of you actually have reduced the amount of money you spend on food because we all really realize that we actually used to eat a lot more. So well done. Thank you very much. So the challenge is we have to stay in the game, and we have to constantly compete with personal weaknesses. Yes, we might, because maybe the group is not going to be as active. The group is still there. We're going to keep it, and we are planning to have a reunion every 3 months to find out where you are at. So we'll continue to offer this support. But the challenge is you'll constantly be competing with your personal weaknesses. Should I take? Should I not? And that's natural. We are imperfect, and we are always going to make mistakes. So please remember, don't beat yourself. Just pick yourself up and go back. I remember a lot of us have fallen off the wagon, not completely, but 1 week, I remember somebody sharing they just could not eat vegetables, or they took too much sugar in their diet. But I know you can do better now. You will not let yourself go off board for a week or 2 or 3. And if you're really struggling, you can call us. We are just within reach, and we can always talk about how we can help you. Then another challenge would be friends telling you what to do. Now you have new friends who have adapted a healthy lifestyle like you. Very good. But you still have family members and friends who do not know what you stand for. So yes, this will be challenging, but you have been here for 24 weeks. You have learned a lot. We've given you lots of resources. So you still need to stand. So remember the challenges, but they really should not be challenges that put you down. So we know you've achieved much, so I won't go there. What I want to do is just give you a few life lessons that I want you to remember. So number 1 is the fleas. When you see the fleas, what do you think about? So I like to listen to motivational speakers, and this particular talk about fleas, I found it in a talk by Zig Ziglar. This talk is titled "Biscuits, Fleas, and Pump Handles." So what do the fleas do? When you put fleas in a jar, in this case, I'm going to use a cup. Oh, maybe I need to remove my. Oh, I need to remove my blur so that you can see what I'm doing. Sorry about that. When you put fleas in a jar, assuming the jar is maybe this side, or let's use a cup for this matter. When you put fleas here and you close this jar, they are just going to fly in there. They will fly inside the cup. And when you remove the lid of the cup, they remain right there. They only fly inside. They will not go out. So what does that mean? In life or in lifestyle, it's how do you train yourself? So if you just want to do the little, that means that you will not grow, you will not be able to stand the test of time. So don't do very little, do more, because when you put the fleas in a bigger jar, they will fly in that space. And when you remove the lid, they only remain there. If you increase the size of the latch, they also stay there. So it's what you train them to do. So in other words, what are you training yourself? Are you training yourself to do more or to do little? So if you just do little, you're going to fall off the wagon. If you do more, you become addiction. Can you imagine being addicted to getting your 10,000 steps every day? It is a very good addiction. So I wish you all the best. So next one is the pump handles. So all of you guys have worked really hard. You've worked really hard. But what happens when you're pumping water? I don't know if you've had this experience of pumping water from underground. A lot of the work goes in pumping. So you find that we pump, you're putting so much energy. And just before the water comes out, you give up, okay? Sorry about that. Just before the water comes out, you give up. But you've done most of the work. So you've done most of the work. So in the last 24 weeks, you have learned, you have posted your pictures, you have asked questions, you have interacted with people, you have done the most work. So do not stop now. Don't give up. when the water has just reached the top. And even when you're pumping that, you know, the little pump for maybe drinking water is the same thing. You have to put in effort when you pumped and then the water just pours. So take care. You've put in all the work. Don't stop now. Continue. Last but not least, I'm sure you know about the Chinese bamboo tree. This Chinese bamboo tree, it stays underground for 5 years. You have to water it, and they water it, and they water it for 5 years. And once, after 5 years, it grows 90 feet in 5 weeks. So it just shoots. In 5 weeks, 90 feet, that's really tall. So what does this mean? You have been watering, you have been doing the groundwork of your lifestyle. You know, you have learned, what you've learned is actually what I teach in a class, a lifestyle management class at the university. And they take, it's like part 1, part 2, and part 3. You've done all of it in 24 weeks. So you've really empowered you. And that is why we are also so proud to have community nutrition champions. So you have watered it. So just like a bamboo tree, now with all the things that we have given you, go out there and make a difference for yourself, for your family, and for your community. You've done all the groundwork already. Let's skip that. So how do we proceed from here? I like this quote by Obama. The future rewards those who press on. Don't complain, just press on. Keep going. Don't complain, just press on. And I want you to remember our famous quotes. Taking drugs without eating properly is like washing hands and drying them in the dirt. So if your family member is sick, if you constantly have a headache, what's going on? If your blood pressure is not high, it's got something to do with hydration status. If you're having constipation, you know what the problem is. Don't go taking laxatives. If you're constantly having a flu and cold, yes, you might need to treat it, but what's the underlying problem? If you're having acidity, what's the underlying problem? So remember, taking drugs without eating properly is like washing your hands and drying them in the dirt. Your diet counts. And remember this, to lengthen thy lives, lessen thy meals. We have experienced this in the program. Hibbah, all of you, Ojwang, Sylvia, all of you have shared the experiences. You used to eat so much kenke, and now you even throw it. You used to eat so much carbohydrates. We went through carbohydrates intelligence. Now you eat so much little, and yet you're full, you're more energetic, and you're happier. So let's keep that. So to lengthen thy lives, lessen those meals. Just remember. And remember, if you can't make time for exercise, or be ready to make time for illness. I made a mistake there. So the quote is, if you can't make time for exercise, be ready to make time for illness. All of you have made so much time for exercise. We never used to exercise much or make so many steps, but people have been making from as low as 100 steps to 15, 20,000 steps. Even there's once I think I did almost 20,000 steps, like the challenge from the group. So let's keep going. Let's make the steps. And last but not least, if you want something you've never had, you must be willing to do something you have never done before. You did it. We are proud of you, and carry on. Keep going, do your best, and we are there to support you all our life. You're now my family. This is what makes me wake up in the morning and go. So thank you very much.
Thank you so much, Alice. Thank you so much. I think that was inspiring. We will go to the next activity. Next on our agenda is a message from Dr. Fay Bruce. Before we have an open forum. Yes. Hi, Fay.
Hi, Hibbah. Hi, good evening, everyone. I'm just I'm inspired, so inspired. I'm kind of a little bit gutted that I didn't actually do the challenge myself. I think I might have sent 1 or 2 plates at the very, very beginning. And I'm just hearing all these amazing stories. I sat and watched the video that you shared with me last week.
Oh, the panel discussion.
I thought, wow, yeah, incredible kind of outcomes that you've had from 24 weeks of input. And I just want to applaud everybody for the work you've put in. I know it's not been easy. I know I'm actually on the WhatsApp forum and I can just see ping, 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 ping all the time, people sending, sharing their plates of food, you know, and I'm thinking, this looks incredible. And you could see actually the portion sizes going down, the different colours that were beginning to emerge on different plates. And, you know, you think this is really doing something. So absolutely fantastic. But yeah, so what a remarkable 24 weeks you've had. And I think it was absolutely worth the investment that we've given to this. So I just look at this and I say, I just remember when I started to do all of my work around CVD, cardiovascular disease, and actually looking at nutrition and what people were saying. Oh, we don't hear about our foods, you know, what kind of foods do we eat that's going to help us? We know heart disease is big in our communities, and what can we eat to actually, you know, improve that? And I remember scoping around Greater Manchester, looking for a dietitian or a nutritionist that was Black, that could actually help to, I suppose, organise our plates in a way that was going to be healthy. There was nobody. I remember going to having a session some time ago, and we had a dietitian that we had to provide all the cultural foods, the African, the Caribbean foods, the yams and everything like that. So she could go away, research that, and then talk about it to our community. That was the best I was getting until Hibbah came along in 2019. And what a godsend, a Black nutritionist that knew about African foods, Caribbean foods. And of course, you know, pre-pandemic, we were out there doing all of this kind of work. And then 2020, of course, pandemic hit. And then we had to go online. But it has been a remarkable journey in that having those sessions with Hibbah, with Alice and others as well and Sylvia, that have all contributed to empowering and educating our community around food. Because we know, and we refer to this every single Saturday on Health Hour, how important nutrition is, whether it's diabetes, whether it's heart disease, whether it's fibroids, you name it. Every single medic will talk about food and the importance of food. So this has been an incredible kind of initiative. And I just want to say thanks to all the ambassadors that are going to take this challenge forward. It's really important because we start these things sometimes and you think, well, it's going to come to an end somehow. But actually, if you've got people championing in that and keeping it and educating and empowering others in the communities, their families, people talking to their friends about it, absolutely fantastic. So we need it to continue. And I'm hoping CAHN can do something more to kind of keep this going. But I want to celebrate this. I want to share this at regional, national level, where we have all our partners, where we can actually showcase what difference that this has made to people in our communities. So once again, absolutely thank you to everybody. Thanks to everyone that's taken part, shared their plates, turned up here every Tuesday, and just to enable this to continue going. So well done, everybody, and all the award holders, and whether you had an award or not, everybody has done incredibly well. So thank you, Hibbah, for allowing me to just say a few words.
Thank you so much, Faye. But I also need to say this here, the genesis of this program. So even though we had these Tuesday sessions that we were doing, Faye called me one day and asked that, is there a way we can go beyond nutrition education? You know, so this is how this started. And, you know, can we have a tailored session so that the people who are always coming for the Tuesday sessions can get more? This is what brought this whole idea. And then I spoke to Alice, that I've told most of you, is mentoring me. You know, she's done a lot of these, you know, back in Africa. And I'm like, okay, this is what Faye said. And then, you know, today we are here. So thank you, Faye. You called me and asked for something, and then we thought about it as a team, myself and then the Sahara nutritionists came together, put together a proposal, and then we had some funding to do this. So thank you so much.
And you delivered, you all delivered. So that's the thing.
Thank you so much for that. Okay, so next on our agenda is an open forum. We want to hear from you. You are free. Usually we ask questions. Today, we don't have a structure. Oh, Alice has her hands up. Okay, please go. Alice, yes.
I wanted to say something about Dr. Fay and Charles. You know, in any organization, I think nutritionists always have to fight, you know, to do something. They have to fight to show that we matter and we can change lives. But Dr. Fay and Charles, you know, you actually just took this up. It means that you really care about your community and you wanted the community to benefit. And we have seen a lot of people benefit from this program. So from the bottom of my heart, thank you for the challenge. Thank you for supporting this. And even the funding, you told us apply for this fund. And then you topped up. So people, please know that it costs money to have this. And Faye and, you know, and the CAHN team were all involved. So thank you so much. Thank you. You've made history. And I'm ready for the next challenge.
And to add to that, when we started Healthy Hearts, there were days that I will prepare and come and do a talk, and I come and there are 7 or 8 people, and it really, I used to be so demoralized. And then I was complaining to Faye, and Faye said, Hibbah, it doesn't matter. Even if 1 or 2 people's lives are changed, that is something. You know, so really these days I'm not all about numbers anymore. Even if 1 or 2 or 3 people, and look at Faye, you need to meet Sarah. Sarah is one of our inspirational stories. I mean, there's so many other people here who have benefited so much, you know, but some certain people talk and then it makes what you do worthwhile. You get this fulfillment that really. What breaks my heart is the fact that we still, you know, people still don't focus so much on prevention. Not you, Faye, I know how much this means to you, but, you know, I see the numbers on Healthy Hour, and then every Saturday they make the announcement that Tuesday there's going to be a nutrition session, but we come and it's always still a handful, okay? At the end of the day, like I said, numbers don't matter, but still we need to change that mentality, you know, about just focusing on treatment, because this has more impact than treatment. Prevention is the way to go and not necessarily just treatment. So thank you again. I guess that's what I'm saying. Yes. Now it's time for an open forum. So please feel free to share your thoughts, you know, impression. Yes. Is Sarah here? I'm hearing someone like that.
Yes, me.
Okay,
somehow I managed to able to squeeze in, you know, somewhere. So hi everybody.
Hello, Sarah.
Right. So yes, my goals were to control my diabetes type 2. 54 years old, and I've been diabetes for 4 years. The other goal was lose weight because I was obese. Now I'm almost overweight. Okay, so, and I needed to help with my mental health situation. I was really depressed. What else? Also, I wanted to impact my family, you know, at home, to make sure they're eating healthy. As you know, the mother, you want the family to be healthy and well. Yeah. So with regards to diabetes, can you hear me?
Yes. Yes, Sarah, we can. Yeah.
Yes, with regards to my diabetes, like first and foremost, this is what I always say, and I will repeat it, that Sahara TLC nutritional whatever it is came to me as God sent at a time when I was really felt depressed because I did not get much support with my diabetes from my doctors and nurses, and my weight, because I used to gain weight and then lose it. I mean, and then I I try to lose it and then I gain it again. So when I joined Sahara, so first of all, I want to say, because I've been told that the sponsors are on here, I'm really, really so grateful because my life has been changed completely. Like the TLC goes total lifestyle change. Exactly. What has happened to me, because I'm very well, because my diabetes is
Sorry, Sarah, we can't hear you well. There's a network problem.
well under control. When I joined you, it was 50.
Sorry, your network is really bad. We can't hear you.
Take the bloods before I joined 50, and my nurse told me that she needs me at 48. So really, it's not really great. So, so anyway, Hibbah or anyone else, you can tell them my situation.
Yeah, we do.
Yeah.
We do. And everybody here is familiar with Sarah's story and how much
I'm no longer depressed. If you can hear that, I don't know if you can hear it. You know, I was beautiful of the depression and all that. Now I can speak. You know, I had stopped speaking to my relatives outside my family because of the depression and the medication side effects. But because of this exercise of this program, can you hear me a bit?
Yes, we can.
Yes, exercise on this program, I've been able to lose 10 kilos. Sometimes it's like 12, but sometimes it's 11. But I can say for sure 10 kilos. Now that's not something I would have been able to achieve. No way. Especially when I was on my antidepressants, they just make you sit down and eat, get hungry and eat, live a sedentary lifestyle. But now, no way. I'm very active. I'm eating well, especially portion control. That really changed my life because that's something I didn't know. I knew about nutrition, you know, but I didn't know portion control. That really helped me a lot. So yeah, that's how I've been able to get my diabetes under control, and I don't have to worry about it. Like what else I need to say? Yeah, it's really yeah.
You've been a real inspiration, Sarah.
Yeah, I'm very
okay. So Sarah, your line
Sarah, thank you very much, Sarah. Thank you very much. Thank you very much.
Can I just say, this is Ajwa. I managed to join today. I sent you a message.
Yes, Ajwa. Yes.
Yeah. I joined. I happened to hear you in a discussion with Amma Manson. I just happened to tune in that day. I hadn't tuned into her for a few weeks. And then you're giving this talk, and so that's how I joined. So I didn't join from the beginning, but it's been a real inspiration, especially with the portion sizes, you know. I didn't think I'd be able to manage it because I've got a sweet tooth to begin with. But it's been brilliant. It's been really brilliant and inspirational. Yeah. And about a year and a half ago, I think I put my name down or responded to a text from my GP. And out of the blue, they called me and arranged for me to join a session starting last week. It's more based on for cardiovascular stuff, so people with high blood pressure and that kind of thing. But it isn't too much about the nutrition as such so far. But we did a bit, but it's nowhere near what I get from here. So I'm just grateful for all that you've imparted to us, to me.
Ajwa, can I read your message?
Oh, I thought you'd already read it. Okay, no problem.
I had it. Yeah. So just sent me this just this evening. Hello, Doc. Where shall I start? I've had an amazing experience on this journey. 2 tiny pieces of yam, 1/3 or half a bowl of kinky, and changing up the veggies with every meal. Awesome. I so wanted to be at last week's session, but received a call to join a health session at 5:30 p.m. last Tuesday, arranged by my GP surgery. It will run from 5:30 to 6:30 every Tuesday. It transpired I had responded to a text someone, oh, this is what you just said 1.5 years ago. I'm not sure how similar to TLC it's going to be. It's headed by a health psychologist and aimed at those of us with high blood pressure and cardiovascular related issues. We've been asked to record our meals, but I'm not sure if we'd have a full-blown nutrition element to it like your program. But I already have a heads up with TLC, and so already glued up on what I should and shouldn't be eating. I'm eternally grateful for all the skills you and your fellow experts have imparted and equipped me with. If you decide to run another, please let me know. Sarah's testimony. Sarah alone just fills me with so much admiration for the work you guys do. Thanks to you, Dr. Alice, Steven, Carol, Elizabeth, Chika, and all the others. The list is endless. I'll try and check it tonight if Zoom allows me to simultaneously join in. And here you are. So stay blessed and more grease to your elbow. This is from Adra. So yeah, when we started the program, I went onto social media because I wanted more people to come on board, and then we talked about it. So a few people joined, and I think these are all people in the UK, not necessarily in Manchester, but they've also benefited. So yes, now we are one big family. CAHN is not just Greater Manchester, it's the whole of UK. We actually have people invited their family members from, Africa. So I know people in Manchester who invited their mothers and their mother-in-laws from, Ghana and Nigeria, and they're all on the page changing. And just, I think one or two of those people, I wanted us to give an award to 74-year-old woman, Granny, who is always measuring her portions and teaching people around her to measure their portions as well, vary their diets, all because her daughter who lives in Manchester invited her to be part of this challenge. So yes, let me stop talking now and ask others it's an open forum time. Please feel free to chip in anything you want us to know. Moving on, yes. What do you want to say? What do you want? Faye is here. CAHN is listening to you. What do you guys want from CAHN? Speak to them.
I just want to say quickly, if you didn't hear me, CAHN, please, we are very grateful for saving my life and my family. And now I'm ambassador, community ambassador. I'm taking the training from Dr. Hibbah and Dr. Alice. Yes, because I have walked the walk.
Amazing. You're very, very welcome. This is what we're about. How do we enable and how do we improve people's lives, and sometimes it's not the huge things that we need to do, but these things will absolutely make a difference. And like somebody said before, how you cascade that information to other people, so we don't have that narrative of poor health throughout our communities. How do we break that cycle? And this is an absolutely fantastic way. So you teach your children and their children will teach their children, and then we eventually get to that point where we are not classed as the most obese, all the CVDs and all the other things that the diabetes that people keep telling us we're prone to. How do we break that? And this is a great way of doing that. I just want to know what's going to happen with the WhatsApp forum. So all those plates that come every morning and dinners and, what's going to happen with all that?
So, that's why we have these ambassadors. We're going to mentor these ambassadors. We've created a page for them. Some of them are going to be the group admin. They are going to be role models. So yes, it's not going to be practical that people will be able to post morning, afternoon, and evening, but we still want to encourage the posting. And the ambassadors are going to take the lead. We will join in, because we think that alone was one of the, motivation to get people to do the right thing. Knowing that, okay, you want to do the right thing. So the page is there. We can't force people to be on. Some people might feel like, okay, I've gotten what I want and they want to go. That is absolutely fine. But for people who want to stay and be part of this family, we would encourage them to stay on. The ambassadors would be the group admin we'll keep going. Healthy Hearts will continue. So it's still be a platform to share weekly topics that are coming, resources. And like Alice said, we are one big family now. You know, we'll be meeting from time to time. If ever there's a chance for us, in fact, that reminds me. So we'll be looking for some small pot of funding to organize something for us to have a meetup. We haven't secured it yet. If we do get that, we would, and well, those locally would benefit more. We are not sure if others can join, but along the line in the coming weeks or month, if we do get it, we might have one get together in Manchester so that we can all come. We don't know ourselves, you know, we know ourselves virtually, but we haven't met ourselves, you know, so we can put a face to who Sarah is, to who Ojwang is, if that is possible. We want this to continue. Let us do a follow-up, you know, after a year to see if these changes, you know, not if we know that these changes are going to impact on our lives, but we want to check on each other. A year's time, 2 years time, 3 years time, how are we doing? You know, those having diabetes and cardiovascular diseases, how have they managed it? Has diabetes gone into remission? You know, we want to follow up on this group for as long as we can, you know, so we will keep the group. We'll keep the group for those who want to stay on. Yeah, that's the plan. Those who can't come will join via, oh yes, those who can't come for the future get together that we are hoping to do can join via Zoom. Yes, indeed, you can join via Zoom. Yeah.
And Hibbah, will you be doing any cooking? I want to know, will this meetup be bring your own food plate?
We'll organize something. We will do cooking. We'll do everything. It's going to be a fun meetup. We're going to do a fun meetup. Yes.
I'm going to come.
You're going to come from Kenya. Yay.
Why not? It's just 8-hour flight.
Just 8 hours.
Of course.
Yeah. So we're looking into getting something. If we do, we want to actually do some, you know, a short, just what we are having, a short documentary, and who knows where that would go. You know, we want to change that narrative. You know, people think that, a lot of people think changing lifestyle is hard. It's not easy, but we have been able to do it. And we want that message to get out there. And then that narrative about healthy eating being too expensive, yes, it is. But for whatever reason, within this group, one of our findings was that if we reduce the portion sizes, we were able to cut down on our usual food budget. You know, it doesn't go to say that healthy eating is not expensive, but it's just because of the way we eat. And people shared their testimonies here. You know, so if you're going to eat 1 tuber of yam in 2 days, but because of this challenge, you are eating it over 1 week, then you're definitely going to cut down on your food budget. You know?
1.5 weeks.
1.5 weeks. Someone is correcting me. No longer. Say, if I know about Ghanaian foods, a lot of the Ghanaians here, there are a couple of Ghanaians here, would not eat less than 1 kinke. It's 1 kinke or 1.5 or 2. But people now cannot finish 1 kinke. It's half kinke and it's become part of them. So if you're eating half a bowl of kinke, then you are definitely cutting down on your food budget, you know. And so
definitely,
this is one of the findings.
Amazing. You need to write this up.
We are going to write it up. But yeah.
Did you have many Caribbeans? I know Sheikah said something about Caribbean foods and things. What was that like?
The proportion was about 90% Africans to 10%. That is a good point. Please let me address this. So, Faye, you know that issue about us not, what did they say about us Black people? That we are hard to reach.
Yeah.
No. So there are 100 plus people on the platform, but a pre-evaluation survey, only 50 people completed it. So I'm telling you that there are about a little over 90 people from African origin and then less than 10% from Caribbean origin. But then maybe there are many more, but people don't fill out survey forms.
No.
They won't. The post-evaluation is the same. We still have about 30-something people, you know, so it makes it difficult. Now, this is another plea that it is important that we get the numbers, we get the data. That is what can tell our story. We are doing something really impactful and beautiful here, but people have refused to complete the surveys. You know, if we don't get those surveys, we don't get, you know, what I explained it the last time, that how do we show the funders or the world that this actually worked? They will forever say that African and Caribbean people have poor eating behaviors. We don't have anything to show.
Sure.
We're changing our behaviors, and we need to complete surveys. So I'm pleading that when we bring out these surveys, please do complete them for us. But Faye is saying, I hope you're going to write it up. If we don't get those numbers, it really, it's not publishable. We are over 100 people, but only 30 plus people have completed the post-evaluation. So that's a huge challenge for us. It's a huge challenge for us as researchers. As you know, we are all researchers as well. So please try and complete the surveys when we do send them to you. That's the only thing we're asking.
So important.
It is important.
Yeah.
Okay.
Alice, is that an issue in Kenya? Is that, do people, reflect, because our community, like you say, is deemed to be hard to engage, hard to reach, all them negative connotations around engaging us. And we often say this, don't we, that anytime there's any form of initiative, research, we don't come forward. But some of that is understanding some of the value behind why they should come forward. So we don't end up with, oh, we weren't included. Well, we weren't included because we didn't come forward. That's the problem. So is that something that, you have, is it identifiable in Kenya? Do people see the value of coming forward and taking part in that?
I think we are maybe a little bit better. People see the value, and I'll give an example of like just collecting data in the slum. They have some surveys in a slum area. That's where slum means that it's what can I say? How do you describe a slum, Hibbah? Help me.
I think they would know slums, those really
deprived,
the slums, deprived communities, villages.
Very low income communities. Sure, they live in shanties and what. But we are actually able to collect data in this community. And these are people with low understanding of research, but the kind of education we've done, I have been able to collect data, and many organizations, HIV, diabetes, name it. And whenever we have, I've had this lifestyle group management programs, and we charge, there's nobody who's going to fund me to do this for free. We charge. And when people pay for it, I used to have only 20 people in one season. They're engaged fully. Your questionnaires they're completely engaged. And once we had a public one online, just to find out what people can do. And you find 80% complete questionnaires. I do a lot of worksite wellness. And before I go into worksite wellness, I send online questionnaires for me to be able to even decide the kind of talk I'm going to give in that organization. You have 80 to 100% participation, So we don't have problem collecting data from people, not at all. I don't know whether it's because I don't know, but we don't have that. We don't have a problem collecting data. It's a lot easier from professionals, and also in the low income, there's a lot of education and awareness that's created. And we collect data, household surveys. We just completed a household survey in a different part of Nairobi. And some of them, they don't get anything. It's just education. They get nothing. They don't get a voucher. They get nothing. But we get the data. So I think we are better here. Hibbah was telling me, and I just couldn't understand how you can't complete a questionnaire. But yeah, it will take time. So a lot of education and a lot of awareness and patience, and eventually we will get them. And if only they can. What we want to, we want you people who are here and in the group to appreciate that we need the data to show that this is worked. We need the data to get more funding so we can do more for you. People have been saying, they want something to do with children, how to help children eat vegetables. We need money to do that. And if you complete the questionnaires, then we will be able to. So it will take time, but I think
absolutely. The first question people ask, how many people are involved? That's the thing. So when you go to funders or if you want to prove your worth in anything, how many people participated? And if you get low numbers, people aren't interested, and that's where we fall down as a community.
And we have over 100 people on the page, but we only have 50 people completing pre-evaluation, and we are not able to compare pre-evaluation with post because 30 people have completed it. It's really sad. Okay.
Yeah, I think we still continue to talk to them in the group, and maybe we can get more people to complete it, you know. Yeah. And please talk to your relatives and friends who you invited, ask them if they've completed the questionnaire. It's really important for our report.
Yeah. Okay, do we have any burning comments from anyone before we go to the final session? We could complete it, address suggesting something when needed at the start of a session, about 5 minutes. Yes, you're right, indeed. Yeah. We tried it once, yes, but that's I think going on. We'll just do it at the beginning of the session. We bring it here. But the other thing is that there are so many people who engaged well, but were not able to come for the sessions. I know like 2-3 people who are always working at this time. So they asked for the resources at the end of the day and they were posting, yeah. But for those who come for the session, that's always averagely 30, or maybe those are the people who completed. I don't know, but yeah. Maybe next time we'll try by bringing the link here so people can complete here. And then we encourage people who invited other family members to also urge them to complete it for us. Okay. If there's no comments, I'll call on. I really want us to hear that poem again before we leave. So Evans, if you're here, do you want to just do the vote of thanks for us? And then we listen to the poem again.
And if you let us know what's happening next.
Yes, so which is something Faye and I was speaking about just before the session, but yes, we're still going to have Healthy Hearts session, as I told you. Every week we're going to have someone. It's not going to be just the 2 or 3 of us here. We have a number of nutritionists and dietitians who are happy to be coming on. So each week is going to be something different. To be honest, I'm going to put next week in the group tomorrow. I need to confirm with this person again, and once he's confirmed, I'll put it in. But we have Healthy Heart is going to continue. So please come along, questions with your questions. We'll let you know the topic in advance so that you can come with your questions. And this will continue. The learning doesn't stop. So please continue engaging, invite your family and friends, and come on and learn. Let's just keep learning. And yes, that's what I can say for now. Dr. Asumini, can we have
hello.
You?
Yeah.
Yes.
I think for the vote of thanks, they've said everything. I don't know what to say again. Because all the thanks and everything we could be grateful for, we've all said it. But I'll just try to summarize so that we can listen to that beautiful poem again. So first of all, on behalf of the Sahara team, I would like to thank the funders very much, the Global Majority Fund, and also to thank CAHN very much. Faye and Charles have been really, really instrumental and have supported us a lot. So thank you very much for all the support you have given to us. And next, I would like to thank Dr. Alice and Hibbah. Without these 2 strong ladies, I don't think we would have been able to do anything. So we're really, really grateful. May the good Lord bless you, keep you well, and give you more energy to carry on the good job. In addition to that, our interns, Steven, Chika, Sylvia, and the entire Sahara nutrition team. There are a lot of people that worked in the background, Dr. Robert, TK, Caroline, a lot of us at the background. So I would like to say a big thank you to all the Sahara nutrition members that made this possible. Thank you very much. And now lastly, as we all know, to all ourselves, we all learned a lot. I think one of the things that kept ringing, and during my PhD, these things were always going. My PhD supervisor kept saying, look, portion size, portion size. It's not that we ethnic minorities do not have healthy foods. No, it's the portion size. So what can we do? So for us, and for us to start from that big portion, let's even use the kinky as an example, to reduce to half is a big achievement. We should pat ourselves at the back. We have done very well. So I'd like to thank everyone that got involved in this program. Without you, there would have been nothing. So we thank you so much for your contribution, for everything throughout. And lastly, as everybody has been saying, I'll just echo on that again. The program has just ended, but TLC continues, a total lifestyle challenge. It is ongoing. We have to become better. So our yesterday, we should become better than that, and eat well, live healthily. So thank you very much, everyone. Yeah.
Thank you so much, Evans. Thank you so much. Carol, please, can we listen to your beautiful poem one more time? And I think some of us should join in. Let me project it and use that. We don't have Orlando today. I'm sorry for those of you who were waiting to exercise, but please go out and do your 10,000 steps. I'm sure he'll come back next week. But let's listen to Carol and then we call it a day. I'll project this now and join in if you can. Where is the PowerPoint slide? 1 second. In future, you'll have to teach us how to write poems as part of.
Can you imagine how she did it really quickly? I wish I could do a quarter of that.
Okay, here it is.
Okay. Do I have control?
No.
Okay.
Yeah, because I'm projecting from here.
Okay, no problem. No, it's okay.
We should all join in.
Yeah.
So don't delay in turning the slides. Then the
No, right. I'm using a new computer. I have to get used. Okay. Yes. Yeah.
Okay. So I'll start. Day 1 looks impossible. Carb counting, portion sizing, plating, jollof and chips and big cake no longer options. Sahara TLC challenge sounds like a desert, an uphill climb. Yes, we can.
Yes, we can.
Week 2, a few days counting. Should I share my photograph? Should I not? Healthy enough or am I slacking? What will they think? What will they say? Wait and see and wait. Yes, we can. Week 6, like fine wine, getting better. A photo here, a step count there. No need to fear, feel free to share. Hit the ground running, meet that 10K. Fall down, take a beat, then get back up. No judgment here, only camaraderie. Yes, we can.
Yes,
we can.
Yes, we can.
Week 12, the end's in sight. Hope lacks on the horizon. One alone and exercising futility. We've been there, we have tried. But one by one, we make a bundle. And when we're in a bundle, there's nothing too hard to handle. Yes, we can.
Yes, we can.
Week 24, now we're like family. The weighing scale no longer the enemy. Portion size control part of our anatomy. Walking daily together, we're now an army. The TLC army. Change is in the air, can you feel it? The atmosphere has shifted, can't you see it? Ready to spread the change, be the change. Sahara TLC challenge, yes we can.
Yes,
yes we can.
Yes we can.
Yes we can.
Yes we can.
Well done.
Yes we can.
Well done, Carol.
Please post it in the group.
Well done, everyone. Sorry?
Please post it in the group for us.
Okay. that should be like the long how do I say, when you're putting out the program, because I know like poetry and stuff like that, rap culture and stuff, it's very central to like Black culture and stuff like that. So yeah, it's really cool, Hibbah, that you came up with the idea of writing something.
In fact, you've reminded me, I just removed my poetry book. I'm going to start reading it again. I kept it away. Let me
Thank you so much, everybody. Thank you, Carol. Thank you so much.
A collection of poems. Thank you for the reminder. I shall do my poems.
I'm glad this is not really ending. I'm a bit emotional. It looks like we've come so long and it's like, it's at the end. No, it's not the end. We will continue engaging in the group. Let's start posting. Let's not stop posting, people. Let's post. Let's keep posting.
We will. Sure, we will.
All right. Thank you all so much.
Thank you.
Thank you, everybody.
Have a good
Thank
evening.
you.
And look out for
Bye.
next week's topic. There's going to be something. I'll share it tomorrow once I get a